Hi and welcome to another video. Today I'll be going over vitiligo. For some key background information, vitiligo is an autoimmune condition characterized by pigment loss, typically in patches, which is secondary to the destruction of melanocytes. And here you can see a photo of someone with vitiligo. For some epidemiology, it affects men and women equally, and it affects all skin types and skin colors. However, the lesions are typically more visible in patients with darker skin tones due to the increased contrast. Whilst it is uncertain what exactly triggers vitiligo, family history and history of other autoimmune conditions such as diabetes or thyroiditis have been linked to an increased incidence. Lastly, vitamin B12 deficiency has also been linked with an increased incidence. How does the condition present? You have well-defined patches of depigmentation, which may be associated with pain or itching, and they can be any size and shape and occur anywhere on the body. On this photo here in the middle, you see someone who has symmetrical vitiligo, which is a common presentation. If someone has lesions on one arm, it is likely they will have some on the other. And you can see in all those photographs, the edges of each patch are very well defined. In lighter skin tones, as you can see on the bottom left photo, the lesions may appear slightly pink, whereas in deeper skin tones, there is a much starker contrast that you can appreciate. The lesions might be repopulated with melanocytes over time. So on the top right here, you see someone who has a patch that is slowly building up some of its melanocytes and skin pigmentation. Lastly, I would like to also talk about vitiligo favoring sites of injury, which is known as the Koebner phenomenon. Here you can see a photo of a patient who does suffer with vitiligo, but has never had any lesions on their abdomen before. And this individual has undergone a procedure which resulted in some damage to the abdominal wall and the skin, and that has triggered the vitiligo to present on their abdomen. How do you investigate it? Clinical examination is typically more than enough to make a diagnosis. However, if there is any doubt, you can perform a Wood's lamp examination where you shine a UV light on the region of depigmentation and it fluoresces under the UV light, as you can see here. You should also perform some basic blood tests just to exclude differential diagnoses. So that includes things like thyroid function tests, inflammatory markers, vitamin D levels, etc. What do you do when you make a diagnosis? How do you manage it? It's very patient dependent. Some patients prefer to just watch and observe, or they believe vitiligo is part of their identity, or they might even like how it looks on their body, and it is a personal choice to make. Topical therapy may be used, so steroid cream such as clobetasol or calcineurin inhibitors such as tacrolimus may be used in patients who are bothered by the appearance of their vitiligo. If these treatments don't work, you may try phototherapy or oral corticosteroids. Lastly, it is crucial patients are provided with adequate sun protection information. The areas with vitiligo lack melanocytes and melanin, resulting in them being way more vulnerable to UV light, which is why they should be covered, whether it's through wearing things like long sleeves or hats, or through the use of sun creams. That is all I have for you on this video. I hope it has been a good brief overview of the condition. If you have any questions, leave them down in the comments. I'll try and answer to the best of my abilities. Thank you so much for watching. I hope you consider subscribing.